Now, you should see the histologyguide.com screen. Is that correct?
Yes.
Okay, good. Okay. Well, what we have here is a low power view of the adrenal gland. This is sort of an unusual section because the adrenal gland is flat. Usually there's kind of a hump here, and some people say it's Y-shaped. But if you go out toward the periphery of the adrenal glands, it will be more flat. The adrenal gland is unique in that it goes all the way around. So there's the outer cortex, goes all the way around. And then the inner part that's darker is the medulla. And of course, the cortex has three different layers. And again, it goes all the way around. So the most peripheral layer, the glomerulosa, goes all the way around the periphery this way. So sometimes it's kind of confusing because depending if you look at it on cross section here, sometimes the glomerulosa is on top, sometimes it's on the bottom. Now, the first thing I just want to point out is they usually state that the zona glomerulosa is what here they say 15% of the adrenal cortex. The zona fasciculata is about 80%, and the zona reticularis is about 7%. But if you look at this slide real carefully, the proportions don't match up. And part of that could just be a sectioning. Another thing could be this may not be human adrenal. I don't know that for a fact. But we will go with these numbers, 15, 80, and 7%, even though it's not represented here in the actual image here. So let's just kind of dive into this. Here's the outer layer is just a thin layer of fibrous tissue. Please remember, there's a rich arterial supply to the adrenal gland. It comes from the periphery inward, and all around the adrenal gland, there are these small feeder arteries. So the blood is always flowing from the outer capsule down through the cortex and into the medulla. So this is the flow of the blood. Now, if we go up to the most peripheral areas here, we can see these cells tend to form little clusters. They kind of form a ball shape, roughly. And if you go to the highest magnification, give a second here, we can see the cytoplasm is the term we use is bubbly. It's vacuolated. And that's because mainly there's a lot of fat within the cytoplasm, usually within a fat vacuole. And again, we know that a lot of steroid synthesis goes on here in the adrenal cortex, and you need a big supply of lipids to synthesize those hormones. So this is why the cytoplasm looks foamy. It's full of fat vacuoles. So this is the glomerulosa layer. Again, they're forming these kind of circular kind of clusters. And the main hormone produced here is aldosterone, which is involved in salt regulation. Now, if you go further down, we kind of start going more into these linear collections. So this is the fasciculata zone here. And again, these cells are very bubbly in appearance, very similar to a granulosa cell. So the reticularis also has the same bubbly cytoplasm. And here you can kind of get a sense of the rich capillary system here. These are probably arterial, some of them. So again, the red blood cells are flowing in this direction downward toward the medulla. And the type of hormone that's secreted here is mainly a glucocorticoid, such as cortisol, but there's sort of a crossover, and some of the sex hormones are also produced in this area, but the main product is a glucocorticoid. Now we go further toward the center, and we notice now the cells look a little bit different. These are also hormone-producing cells. They still have a somewhat foamy cytoplasm. They look a little bit darker but you can still make out some foaminess to so the cytoplasm is darker, more eosinophilic. And if we go further down, let me see if I can find a good area. You have to look around here. Sometimes in this lower level of the reticularis, you can find some light brown pigment in the cytoplasm. You can kind of make it out here, here, here. It looks kind of smudgy brown. Here you can see little brown dots. That's lipofuscin pigments. You also see lipofuscin in the liver. And basically, it's just like a breakdown product where the cell doesn't really need it, but it has no way of getting rid of it. So it just gets stuck in the cytoplasm, lipofuscin. So the main point is it gives it a slight brown color that it may help identify that you're in the reticularis. And again, you can see the red blood cells. Now they're pulling up here. There's some stasis going on here. But again, the blood is flowing this downward direction. And again, the main product form here are the gonadotropins, the sex hormones. And they still produce some glucocorticoids here in this area, some. So the ratio of those two is flipped. Now, if we keep on going down deeper, now we're into the medulla. You can tell we're in the medulla because we start seeing these darker purple cells. This is kind of a weird area here. Let's try and find a better section here. And there are actually some foam cells still intermixed in here, but what we really want to concentrate are these cells with darker purple, very granular cytoplasm here. These are the chromaffin cells. These are originated from postsynaptic neurons, and they're full of neurosecretory vesicles. So when properly stimulated, they can put a large amount of epinephrine and norepinephrine directly into the vascular system. Again, you can make out these arterioles, this pack full of red blood cells. So that's when they're stimulated, boom, you can get all that epinephrine in your blood system very rapidly. Now I'm going to click on something else here. Yeah, because it's formed of neural tissue, the medulla, you can sometimes get a ganglion cell. You can recognize them. They're relatively large. They have this deep eosinophilic cytoplasm. They're not very foamy. And they have this large nucleus with a very prominent nucleolate. Kind of looks like an eyeball looking back at you. So these are relatively hard to find. It's a ganglion cell, but again, it's indicative of this medulla is of neural origin. Okay. Now, one other feature I want to just mention in passing is if you stroll through the medulla, you find these fairly large veins. I think they call it adrenal medullary central veins. And that's where the blood that goes all the way through the cortex. Remember, the blood's coming this direction. This is where it ends up eventually in this large vein. And also the products from the medulla drain into these veins. And when you go and look at these veins, they're fairly large, thick walled, and they have lots of smooth muscle bundles forming the walls, which is not unusual. It's just that for the relative size of the vein, these are relatively thick. I think let me try and find another one here. This one's rather thin, but look how thick these smooth muscle bundles are here. They're really thick. So the thinking is when your body needs, let's say, a good shot of epinephrine, you're in a fight or flight situation, these smooth muscle bundles are going to contract. And they contract so tightly, they actually squeeze down the entire adrenal gland a couple of millimeters, just like squeezing down on a sponge. And all the juices are squeezed out into this vein and then out into the body. Okay, so those are the major findings of the adrenal gland. Any questions? I always encourage you to come back later and kind of zoom around and get a lay of the land. I try and get all the images in your pre-read material directly from histology guide, so you should see similarities. And we're just going to have a real brief session at the end about islets of Langerhans. And we already talked about the pancreas in the GI section. And again, the pancreas is an exocrine gland. Its main function is to produce digestive enzymes in these clusters of cells called acinar cells. And they're making products, enzymes that are dumped into the center. It starts going into a ductal system that merges into larger and larger ducts. Let's try and find some of the ducts here. Well, here's a really large duct. Eventually, they'll all drain into a larger duct. These travel out to the ampulla vater, and the ampulla vater will drain into the duodenum. So again, the main function by volume of the pancreas is to make digestive enzymes. And we already know that there are specialized cells within the pancreas that are endocrine. And in this particular stain, they pop out nicely. They're lighter. They form a nice kind of a round structure. And that's an islet of Langerhans. And there's some sections that show a lot more. Here, and here. So, just from this low power view, we can see the islet cells make up a relatively small fraction of the pancreas. Okay, any questions about the islets of Langerhans? Okay, I would mention real fast too that on H&E, we normally can't tell the different subtypes of cells. The subtypes of cells will become important, but we'll go over that toward the end of this ILS session. So, let's go on to my little kind of running quiz and teaching material. Now, you should see the title slide, ILS-3 apps, adrenal gland, islets of Langerhans. Okay, good. So let's jump into this. Okay, so here's the first question. I'll give you about 40 seconds. I think that's about all you need to read this. And we're not going to break down into groups. So we just do this as one big group. So, okay. I'd like to just make a statement that I originally had this question in here, but I'm going to take this answer out because one of your classmates emailed me and said, I think I found an error in your slide, and it had to do with which adrenal gland is more superior than the other. And I actually had that flipped around. And so I'd like to thank her for finding that error. And I really respect members of your class. They're reading these notes very carefully, and to catch that kind of a subtle error was really insightful. And so I'll get into this here. But before I go on here, so B is not considered an answer because there's a screw up on my part. So let's see. Let's start with group two. Group two. What do you think the answer is? Just shout it out. Group two.
I was thinking potentially C. Yeah, okay. I think that the left side usually seems more up and down, elongated to me.
Okay. That's good. Does anyone else from group 2 have any thoughts on this matter? Okay, well, let's go on here. Let me get my little pointer up and running here. Okay, so the error that was found was this image had been flipped around. I have it corrected here, but when you looked at it, they realized the liver is on the wrong side. So that was a good, so that was a great pickup. And then the text that went with it was consistently wrong. And so actually the left adrenal gland tends to be slightly higher than the right, because on the right side, it's on top of the kidney, but it's being pushed down by the liver. So this is the correct orientation here. Now, going back to the question at hand, we talked about different shapes of the adrenal glands, and that's the answer we're trying to get at. The right side tends to be more cap-like. Another term people use is looks like a pyramid, so it's kind of pointy on top, while the left side is more linear, it's more elongated. And, I thought about it for a while ago. Well, they say it looks like a cap. Well, this is probably the closest cap I can think of. Is like a paper party hat like this you make from newspapers for the kids. So it's wider at the base and it's pointed at top. So that'd be the right. And also in the same line of thought of paper hats, the left adrenal is more like I think the term for this is a soda jerk hat. You can buy these called, you look at under Amazon, and soda jerk hat, and it's long. And when you think about it, this analogy is not that far off, because the adrenal glands sit on top of the kidney. The kidney is rounded, sort of like your head. So this is pretty representative of how these glands do sit on top of the kidneys, right and left. And when you section these adrenal glands, you get these different cross sections. The ones toward the middle of the cross sections tend to have this Y shape. So we have a really happy Y because he's a Y shape. The reason I make a big stink about this is when you look at CT scans, oftentimes the adrenal gland is relatively small. We tend to be robust people. We have a lot of extra fat, and the adrenal glands kind of get lost in all this fat. So you have to look for these tiny Y-shaped sections on CT cuts, and that's what you're looking for. I was also thinking about this last night and thinking, well, gee, I have 2 kids representing the shape of the adrenal gland. And actually, that's not too far off, because remember, part of the adrenal gland makes aldosterone that's involved in salt metabolism. And kids love to eat salty things at parties, right? Like the potato chips and nuts. And the other thing kids like to eat at parties is like ice cream or candy. And that fits into the glucocorticoids that's secreted by the adrenal gland. So the adrenal gland is really a party animal. And if we want to take that one step further, you can think it also produces sex hormones. So that's not a kid's party. That's a different kind of party, I guess. So you think of the adrenal gland like a party gland. Okay, so what we wanted was see they are similar. The right side looks like a cap. The left side looks more elongated. Cross section, I had Z is really a Y. Okay. Any questions about the adrenal gland? Okay, good. So this one's pretty straightforward. Let's take a few seconds. How about group 10? Group 10, you want to just shout out what you think the right answer is? Group 10?
Sure. The adrenal cortex is from mesoderm, and the ectoderm. So that would be, what did I just say? Mesoderm and ectoderm. B.
B. Okay, good. So here's the cartoon that was in the pre-read. This is a little bit more complex than it needs to be, but basically during the very early embryonic development. We have the neural crest forming here. That's ectoderm. Some of the cells migrate off and they intermix with mesoderm. They end up here in the urogenital ridge. They form a cluster, and this eventually will become the adrenal gland. Again, the fetal medulla originates from the neural crest, ectoderm, and it finally finds its way into the center. And then it's surrounded by the mesoderm or the cortex. Oh, well, one thing I learned was, I used the same cartoon in the pre-read, but it wasn't until I magnified this to make it larger that I realized whoever made this cartoon didn't label it correctly. So if you go back in the pre-read, you'll see that these are labeled incorrectly. I've corrected it here, but if you're into collecting stuff, you may want to go back and change that. Though that was the main point of the cartoon. The cartoon was just trying to point out that the ectoderm is in the center and the mesoderm's on the outside. Though I have to admit, I'm always surprised when you find errors like that in a textbook. They should have caught that. So the answer is ectoderm and mesoderm. Any questions about that? Okay. Oh, this one's a little bit trickier. Let me give you at least like a minute and 40 seconds on this. Okay, let's pick a fun group here. Let's try group 6. You look like a fun group, group 6. Now, instead of just asking for the answer, I'm going to go about this differently. Okay, so we've got something that was found in the retroperitoneum. It was just found incidentally, so apparently the patient didn't have symptoms dealing with this mass. We really don't say how big it is. We just say it's small. We say it's removed, and we have a microscopic image of it. So we're asking you to identify what do you think this looks most like. So let me ask this question of group 6. Could it be a lymph node? Group 6, do you think this could be a lymph node?
No, I don't think so.
You don't think so? And why?
I don't know. I feel like there would be more like capillaries and stuff that are visible.
Okay. Anyone else from group 6? Does anyone even remotely want to say that? I think it could be a lymph node.
I agree with Steve. I don't think it's a lymph node. It just doesn't. I don't know that I can verbalize exactly why, but it just doesn't look like what I remember lymph nodes looking like.
Okay, it doesn't look like what you've seen in a lymph node. Well, that's the start. Okay, so let's keep on with group 6. You got it. Could it be ectopic kidney?
I was thinking that because there's like a change of tissue and maybe
a little bit of an adipocyte, perhaps. It was more of a adrenal cortex sample.
Okay, so you're jumping to adrenal cortex. Okay, that's fine. But actually, I'm trying to ask a more pointed question, like, could it be kidney? Let me just toy with you. So someone else in group 6, let's say I met you on the street, says, I'll give you $50 if you tell me this is a kidney, and you can tell me why. What kind of place do you live in? Where they ask you?
There's no Bowman's capsules or glomerulus or anything like that. So
yeah, I agree. Nothing that looks like nephrons like that.
Yeah. So you can cross off kidney, you can cross off lymph node, blah blah blah. You just kind of go down the list. Like, I know what certain things look like. I know it's not that. So that's sort of the thought process I'm going through. The other point I'm trying to make is, we do find ectopic tissue in the retroperitoneum. And why is it there? It's there because embryologically it comes from mesoderm, and mesoderm is responsible for adrenal gland, gonads, and kidneys. And they're sort of moving around during embryology, all in the retroperitoneal area. And so any one of these glands, while they're moving around during development, can have a few cells break off, and they're left behind. And if they develop a blood supply, they can start to grow. Probably if we dissected enough cadavers and looked hard enough, we can probably find some ectopic tissue in a fairly high percentage of people, but it's just that they're too small and we don't care to find them. We're not going to take the hours it takes to find such things, but that's why they're there. It's because they develop from the same embryologic tissue. They're moving up and down. And so this is what I'm sort of asking, like this is a lymph node. If you had, and possibly on the boards, they could ask you, they could show you this picture, and you just have to know it's a lymph node. And then they're going to ask you a bunch of questions related to lymph node. But if you don't know it's a lymph node, you're just kind of like, well, what the heck are they talking about? So lymph nodes, you can identify, they're full of tiny lymphocytes. Lymphocytes have a lot of chromatin. That's why overall it looks purple. And it's full of these tiny dots because lymphocytes tend to be small. This is a germinal center. Germinal center, it's a little bit lighter because the bigger lymphocytes tend to hang out in the center. And this is where they're processing all those antigens. It's really a busy area here. So you should be able to recognize the lymph node at low power. You mentioned the kidney, you talked about glomeruli, Bowman's capsule, tubules, et cetera. And so I think a reasonable first-year medical student say, yeah, that's kidney. That's what I remember kidney look at. Pancreas, remember, has, if you get the right section, you have islets and Langerhans. They're lighter, they're round. The rest are these little acinar structures, and you have a duct. And then the adrenal medulla, we just talked about briefly at the very beginning. They're darker cells. They have these dark cytoplasm that's very granular because they're full of neurosecretory granules. These have these white spaces here. That's probably just an empty capillary. There's some other cells that are kind of cleared out. I'm really not quite sure what these are in the medulla in this particular section. And again, you can make out blood vessels, rich either capillary or arterial system here. Okay, so the answer is ectopic adrenal cortex, not medulla, cortex. And if you look at this and think about it, this actually could have just been a shot from histologyguide.com looking at the periphery of an adrenal gland, because these cells are kind of forming clusters. So that could be the glomerulosa zone here. Yeah. Now, someone from the other group asked me, well, would I expect to see medullocortical central vein and other structures? And the answer is no, because we're dealing with ectopic tissue. Sometimes histologically, it looks exactly like the tissue that it came from, but usually it's disorganized. You won't have the usual anatomic structures, the full complement of anatomic structures you would see in a normal adrenal gland. And so this is an example of ectopic adrenal cortex. Actually, for the patient, this probably was non-secreting. It probably had no clinical significance to the patient other than they found it and they're kind of worried now. Patients know, God, there's something in me. I don't know what it is. The doctor said it might be cancer. Please take it out. And usually I make a little statement here about we're finding more and more things in the body because we're putting more people in CT scanners. And one area that is of interest to me is there are recommendations that people with a history of cigarette smoking should get routine CT scans of the lung to look for early lung cancer. And I believe most insurance companies will pay for that service now. And it is true. People who develop lung cancer who get annual CT scans, they can find the cancer at a really early stage. The tumors are small, that can be completely excised. And these patients do extremely well. The downside that most people don't talk about is not every nodule in our lungs is lung cancer. In fact, the vast majority of nodules that are found on CT scans are benign. There's something else, but they're not cancer. And so probably for every lung cancer we find, there's probably 6, 7, or 8 patients with a lung nodule that's not cancer when they biopsy it. So actually radiologists are pretty mum on this. It's a great source of revenue for them, getting people coming in every year for a CT scan. Some doctors purposely put in CT scans into the office because they can make money off of people getting yearly CT scans if they're smokers. Pathologists, we're pretty numb. We don't say much about this because we get paid for looking at all these biopsies. But this is one of those cost-benefit analysis that will probably come up again and again during your lifetimes as physicians of, how do we get the most good for society without creating more havoc for people that don't have lung cancer. So enough of that. Let me go on here. This should be a short question. Let me just give you a few seconds to read this. Let's jump to group 5. Group 5, I don't want to push you too fast on this. I'm assuming you can scan this quickly. Can you just shout out what you think the answer is?
Yeah, I'm thinking it's C.
Okay, glucocorticoids mostly, and some gonadotropes. Okay. Does everyone else in your group agree with that? Why don't you guys shout out like, yeah, that's fine, or no, I don't agree.
Yeah, I agree with what BB said.
Mm-hmm. Yep.
Okay, that's good. I believe that's the answer. You want it? Yeah. Okay, that's the answer. And again, here's the slide. It's sort of, again, I tend to get lazy and just say, read this and memorize it because it's going to be a test question. But again, there are several things to keep in mind, and that is the layer of the adrenal cortex. They have 3 different names. They produce 3 different hormones, or at least 2 of them produce them in different proportions. And probably that's important to know. And maybe some of the names, for instance, glucocorticoids, you probably remember cortisol is being discussed. And then on the gonadotropes, the DHEA, DHEAS, and androstenedione. Okay. Those are some of those. And again, the zona reticularis, the cytoplasm looks different. It's not that foamy cytoplasm. So you can always go back to this, kind of refresh your memory before the exam. Okay. You know me, I like to throw in an EM photomicrograph. And let me just pick on group 9. I'm going to pick on group 9 and kind of tease you a little bit on this. Okay, so we've got this electron micrograph here, and let's just start with this. Well, what is this big round thing here? Group 9? Hello, group 9.
Sorry. I think that's a nucleus.
That's nucleus, that's right. Usually the big round thing with kind of grainy looking stuff, that's the nucleus. So that's a good place to start. And also group 9, what about these cleared out, punched out spaces?
I'm not sure if those are vacuoles or something else, or
Okay.
secondary granules, but there's no ER that I can see right here. So
Yeah, I heard someone else say something. What else are you thinking?
I was thinking maybe lipid droplets.
Lipid droplets, okay. I think that's a good thought. And here's some other round things here. Yeah. What do you think these round things are here? We're kind of all over the place. I'll give you a hint that we usually don't think of them as round, but if you cut them.
Are they?
I'm sorry?
Sorry, I didn't mean to interrupt. I was thinking they might be mitochondria that got cut like transversely instead of.
Yeah. These could be mitochondria, this cut in cross section. They just, were lining up a certain way, and this particular cut, they look like circles instead of being shaped or something. And so basically we have a nucleus, we have lots of lipid droplets, lots of mitochondria. There could be something else in the background, but this is kind of a grainy photograph. And so I think we have our answer here. We have abundant lipid droplets and mitochondria. Now the other thing we can go, so one approach is, okay, let's just try and figure out what we're looking at. The other way of approaching the question is, okay, this is from the adrenal cortex. In the adrenal cortex, we know synthesizes steroids. Whoa, we had all these lectures about, how cells make steroid hormones. And, what are the features? One is, they have, droplets of fat, esterified cholesterol, and they have mitochondria because that's where the cholesterol is transported into, and cholesterol desmolase and all that kind of business. So you need fat, you need mitochondria. There's one more thing you need to make a steroid hormone. Group 9, you're not off the hook yet.
STAR or ACTH?
No, I'm talking about organelle.
Oh, sorry.
Endoplasmic reticulum.
Yeah, smooth endoplasmic reticulum. Okay. The big thing is rough endoplasmic reticulum has ribosomes on it because they're producing peptides. Okay, so you think more of a peptide hormone here. And dense core granules are usually peptides. And so again, you would think they're producing peptides. Now there is an exception. That would be the adrenal medulla. Would have lots of dense core granules, but the question is about the adrenal cortex. So if you know the EMs from the adrenal cortex, without even seeing an image, you go, okay, there should be fat droplets, there should be mitochondria, there should be smooth ER. So we have at least 2 of the 3. So that's enough to, sort of narrow down the answer.
Dr. Honda?
Yeah.
Would you mind really quick? I'm having a difficult time seeing any sort of endoplasmic reticulum in that slide, which I know is very important for the synthesis.
I think it's in the background, but it's such a grainy old picture, it just doesn't show up.
Okay, thank you.
Yeah. So this is more of a technical problem here on this slide. I think for any exam question, I'll try and have something a lot better than this. So this is the example that's in the pre-read. This shows the lipid droplets. Instead of being absolutely clear, there's some like tissue paper looking crumpled stuff in there. That's probably more common the way lipids look. And you can see the mitochondria here, they're kind of elongated, with that cristae structure in it. And this is a magnified area of somewhere here. And this is smooth endoplasmic reticulum here. So this would be a much better representation of the adrenal cortex. But sometimes dealing with a crappy picture forces you to kind of think it through. This is also in the pre-read, just to point out some of the difference between steroid secreting cells and peptide secreting cells. Again, these little cannonball things, those are neurosecretory granules. In the context of adrenal gland, that's got to be the medulla. Okay. And also the medulla, because it's synthesizing a peptide hormone, it's going to have rough endoplasmic reticulum. That's rough endoplasmic reticulum because it's got the ribosomes on it. Now, going back up to steroid secreting cells, they have fat droplets. This one shows the crumpled paper kind of look, but it's mainly clear looking. And here's smooth endoplasmic reticulum. This is a slightly different look where it's outlined better. There's one other subtle feature that's mentioned in some texts. They say that the mitochondria look different in steroid secreting cells. They say the cristae look more tubular than these over here. These kind of are interdigitating here. I don't know if I really see this in a lot of micrographs that I've seen. So I don't think, I won't ask something like that, but definitely fat or lipid droplets, smooth versus rough endoplasmic reticulum, neurosecretory granules or no neurosecretory granules. These are all things that will ultimately be asked on a test in one form or another. Okay, so abundant lipid droplets and mitochondria. Any questions about electron micrographs? I believe histology.com or histologyguide.com also has a selection of electron micrographs. I think some of them I used in the pre-read. Others are good to kind of flip through to kind of test yourself again. Okay, let's just spend a minute reading this. Let's pick on group 4. Group 4, I just want to shout out. Just shout out what you think the right answer is. Group 4, you still think?
I guess I can try and answer. So
yeah.
I thought that the medulla was like essentially a modified postsynaptic neuron.
Yep. Okay.
But so I'm thinking that, but I honestly I'm not
100% sure. Okay, but
yeah,
you're pretty sure it's a neuron though, right?
Yeah.
Yeah.
Yeah, I think it's neuron.
Okay, so neurons are like presynaptic or postsynaptic. So it's neuron. So you got it down to 2 easily, but you're going to go with postsynaptic. Okay, so let me just jump here. Here's the slide from the pre-read. Again, here's where the medulla is, way down here, and it's got that deep dark granular cytoplasm, lots of blood vessels. And if you read the text here, it says chromaffin cells are modified postsynaptic neurons, which lack axons. And they also mention here there are rare ganglion cells intermixed in there, which are not shown in this picture. Okay, so you're on the right track. You got it. You got it. Postsynaptic nervous cells, neurons. And again, if we went to the adrenal medulla, did electron micrograph, here are those little cannonballs, BBs, or whatever you want to call them, round and dark. Those are the neurosecretory granules. In this case, they're either norepinephrine or epinephrine. Postsynaptic neurons. Okay, good. This one, I'll have to give you a little time to think about this. So let's give you another 30 seconds or so. Okay. Oh, I jumped to the answer here, so I lost track here. Let's just pick group 8 real fast. Group 8, just shout out what you think the right answer is.
Honda, I think it's middle suprarenal artery because the superior one comes from the splenic artery and the inferior one comes from the renal artery. So I'm pretty sure it's middle suprarenal.
Okay, let's check it out here. Here's a modified cartoon that I found on the internet that really kind of again, remember now, the blood flows in the adrenal gland from the capsule from the outside and it condenses, all goes to the middle. So all these little feeder arteries on the outside. Superior ones come off the inferior phrenic artery. The inferior ones come off the renal artery here. And the middle suprarenal arteries come off from the aorta. So you got it right. So I think part of the take-home message is there are 3 different supplies for one gland. That's kind of unusual. But again, it's an endocrine gland. They want them to be richly vascularized so they can dump their hormones into the blood system, get to the body quickly. Okay. Now this one's a little bit trickier. Let me give you like a good minute and a half on this one. Okay, group 1, I just want to shout out, just tell me what you think the right answer is.
Is it E?
Right suprarenal vein. Okay, what does the rest of the group think? Go along with that?
I agree with that.
Okay, good. Well, let me kind of preface this on why we're even asking this question, because it is hypothetically something that we would want to do. We have an endocrinologist, they suspect the patient has some type of adrenal tumor on the right side. That's an important fact to make, or right-sided. Now, why do you think they want to get a blood sample directly from the adrenal gland rather than just sending the patient to the lab to get their blood drawn from the arm? Group 1. Group 1, what do you think? Why do they have to go all this trouble to get the sample near the adrenal gland versus just from the arm?
Go ahead.
It's okay, someone just start. It's okay to guess. Guessing is fine. We're all friends here on this. Group 1, are you there? Are they having a discussion offline or something?
Okay, no, I was waiting, but I would say because the testosterone is being directly made from the medulla, so you want the highest concentration of it when it's in that vein compared to taking it when it's mixed in with everything else.
Okay, so
it also be go ahead.
Yeah, go ahead. I think you're right.
I think that's about it.
Okay, well, I think it was mentioned somewhere in the pre-read somewhere that the half-life of epinephrine or norepinephrine is relatively short. If someone's saying 2 minutes, right, something like that, something short. The other thing too is that they immediately get dumped into the inferior vena cava. They end up going through the liver through the first pass. The liver tends to deactivate lots of things. That's another reason. And so it's pretty hard to get an accurate measurement, especially if the tumor is not always secreting these things. Sometimes the tumors secrete these, whenever they feel like it. And you may get a peripheral blood sample from the arm, and it could be perfectly normal. It could be very, very misleading. So that's why they're going to go to all the trouble to send this person to a radiologist. And they really want to confirm the diagnosis, because they're going to have the adrenal gland excised, which is a fairly involved procedure, and they don't want this removed unless they absolutely have to. And so the radiologists are very good. They put a catheter into your groin, and they can, kind of use all different imaging techniques to guide the wire exactly to where they want to get the blood sample. I'll share a little story I heard many, many years ago. There was a patient I heard about that complained of nervousness and agitation, and he couldn't explain what was going on with him. And he had this one unusual complaint. He says, every time my wife hugs me, I get the worst headache I've ever had. And, people were really confused. What did this person have? Well, it turns out he had an adrenal tumor, and it was large enough that whenever his wife gave him a squeeze, she was squeezing epinephrine and norepinephrine into her husband's blood system, which caused massive constriction, which gave him a huge headache every time. And I believe they actually had to do a procedure like this to sample the epinephrine, norepinephrine directly from the adrenal gland. I don't remember if it was the right or left, but I think everyone talked about that scenario because it was such a almost humorous story of a symptom. Okay, so to answer this, you just need to know the anatomy. Okay, you go back to a nice cartoon, and okay, blood is actually flowing back in this way, right? Because we're in the venous system, everything's going back up to the heart. Here's the right adrenal gland, and it dumps its venous blood directly into the inferior vena cava. So obviously you want to snake up a catheter up here and jab it in there. So the question is kind of worded weird. It says, well, what if I take the blood way down here? Well, that doesn't do you any good because the hormones that's releasing is up here and it's going this direction. Well, what if I have it in inferior vena cava and take it down here? Well, that again defeats the purpose. What if I take it here? Defeats the purpose. You got to get it right up here. Or if you go a little bit beyond, I guess one could argue that's close enough, but it's being diluted by the rest of the venous blood here. Now, if the endocrinologist said, no, it's the left adrenal we're worried about, he or she has got to put the catheter in here. I don't think they can thread it into the left renal vein and thread it up this way. I think the best thing to do is get down here. But you can see there are two different places that they have to target depending if it's right or left. So if anyone's interested in radiology, this is something, a bit of anatomy you need to pick up. The rest of us probably just need to know this for a test, and then you've got more important things to memorize. Here's the same image was used in pre-read, and we actually do have this sort of reversed X-ray that shows a catheter going into that area, the right adrenal gland, looking at the venous drainage. Okay, right suprarenal vein. Sometimes you really need to know this anatomy very, very well. Okay, this one, we're getting low on time. Let me just kind of run through this real fast. This is one of those things where, okay, you look at it, you scan it real fast. So the answer is it pre or post-ganglionic? Pre or post-ganglionic? Is it parasympathetic or sympathetic? Does it involve T5, T8? So this, you just have to know, it is or it is not. And this is probably just a distractor. So, is innervation, is it pre-ganglionic or post-ganglionic? So if you can remember is pre-ganglionic, then you're down to 2. You just have to remember, are they coming from T5, T8? And you got the answer. So here's the actual slide that will help you answer that. And the take-home message again is these are presynaptic neurons here that go into the celiac ganglia, but do not synapse there. They go partially into it and out, go directly to the adrenal medulla. And again, the adrenal medulla is sort of like a secondary backup system for the sympathetic nervous system. The sympathetic nervous system gets stimulated when your body is in fight or flight. You want to release insulin, you want to get your muscles going, you want everything ready so you can fight or you can flight. And so it's so important that the body during its development says, well, I need a backup system. So we'll stick something in the adrenal gland. And in addition to all the sympathetic nerves firing off, they'll fire off in the adrenal gland and it will dump into the whole blood system, epinephrine and norepinephrine, to make sure that we're ready to go. So again, the answer is pre-ganglionic nerve fibers originating from T5 through T8. It's just one of those factoids that will help you on a test. My test, I don't know. I don't remember if I asked the question or not on this. This is a fast question. The islets of Langerhans make up what percent of the pancreas? Is it 90, 75, 50, 10, 1 to 2%? And again, we just looked at the pancreas, it's not very much, 10%, probably less than 10%. So let's go to 1 to 2%. The other factoid is even though the islets make up a very small percentage of the pancreas, they believe up to 15% of the blood flow to the pancreas goes to the islets. Again, it points to the need for a big blood supply so the islets can be dumping its products into the blood system rapidly. And of course, the biggest product is insulin, and the body is continually metabolizing glucose, so it needs insulin. 11, this is kind of a tricky one. The islets of Langerhans arise from which type of cells? This is not the best question in the world, but is it a duct cell? Is it a pancreatic exocrine cell? Is it a histiocyte? Is it neurocrest? Well, we haven't said anything about histiocytes, so we can say probably not. You just threw that in just to throw us off. Probably not the exocrine cells, right? Because we always talk about the exocrine are not the same as the islet cells, so that's probably not correct. Neurocrest, well, if we were talking about the medulla, adrenal medulla, yeah, that could be neurocrest, but we're talking about islet cells. The question is, are islet cells neurocrest? And so could it be a pancreatic duct cell? So A is what we're looking for, but let me explain why. So going back to how the pancreas develops embryologically, it starts off as a series of ducts that are mainly straight. And then these ducts start to branch in all different directions. And then within these developing ducts, they start to differentiate. Some differentiate actually into the acinar cells. These are the cells that are going to have the xylogen granules. They're going to be dumping all kind of digestive enzymes to the duct system over here, okay? And also arising from the ducts are the islet cells. So they bud off and they start producing their own clusters of cells, the islets of Langerhans. Now, this cartoon is interesting because they show the islets of Langerhans, because they arose from the duct cells, are still relatively close to the ducts. But again, the take-home message is they do not deposit their products into the ducts. They deposit their products into the vascular system. But they do arise from the duct system. And this is something that I think was just mentioned in passing, but I just wanted to emphasize it. If you think about the enteroendocrine cells in the GI tract, remember the GI tract has all these little cells that are producing, GI hormones that are needed for motility and, stimulating acid secretion, all this kind of business. These enteroendocrine cells are part of these crypts that are epithelial cells. And this is where the cell division is here at the very base of the crypt. So they bud off and then they differentiate into these enteroendocrine cells. And these are the cells secreting all these GI hormones. Now, actually, when you think about the islets of Langerhans, are very similar to this because they're budding off from an epithelial cell, the ducts, and they're specializing. And if you take these enteroendocrine cells and they kind of leave the duct and they start proliferating, then you have islet cells. So they're sort of similar in how they develop embryologically. And this was a photomicrograph. This is from the DSA, showing cells that synthesize secretin. Again, they develop from these crypts and they're scattered throughout. So pancreatic duct cells is where the islets come from. And finally, this
Dr. Honda?
Yeah.
Sorry, can I ask you a quick question? On slide 23 of the pre-work.
Okay, I don't have that open in front of me. You'll just have to.
Do you mind if I share my screen real quick? Oh, I can't. Never mind. You're sharing yours.
No. Just tell us what's on it.
Okay, it says the islets of Langerhans arise from duct epithelium of the exocrine pancreas.
Mm-hmm.
So is that's still correct? The exocrine pancreas part?
Yep. Because when you think about the ducts, is where both the exocrine pancreas and the islet cells, they come from the same embryologic duct system. I think that's what I'm trying to say.
Okay.
So let's go on. Last question for the day. We've gone a little bit longer than I wanted to. That's okay. We're still within our time frame here. The model below represents an islets of Langerhans. The green cells secrete which hormone? And got two different groups to call from. Let's go with group 3. Group 3. So group 7 got off scot-free today. Group 3. How would you want to answer this?
I think maybe those are the delta cells, so somatostatin.
I think they're delta cells. Okay, the green cells. Do you think the green cells make up the bulk of the islets in this diagram? I think there are a lot of green cells there, right?
Yeah.
Okay.
I think so.
Okay, so let's kind of jump back here. This is the cell improvement. So the greatest number of cells are actually the beta cells. They're producing insulin. Now you were talking about what delta cells. Delta cells, they make up less than 10%. So that's more than 10% there, right? Okay. So if these make up the bulk of the cells in the islets, what are they producing? Say it. Anyone?
Insulin.
Insulin. There you go. Okay. Yeah. So this is a basic fact. It'll come out again in TBL5, obviously, because that's what the whole TBL is about: insulin, glucose metabolism, and it sort of makes sense because that's what you need the most of, during your day-to-day activities of eating. You need insulin. So most of the islets of Langerhans can be involved with that. Now, like I said, on the H&E stains, you really can't tell the difference between alpha and beta cells. But if you do special immunohistochemistry with special antibodies directed toward these products, here are the alpha cells. They're mainly on the periphery, a few on the inside. So the alpha cells here, I believe, are in red. Those are the ones that produce glucagon. The greatest number of cells here, you can see they sort of make up the bulk of the whole islet. Those are the beta cells. They secrete insulin. Then you have delta, epsilon, and double P cells, which I'm not even going to talk about. But I would say that there's general information here that is probably considered general knowledge. And so I would say, especially this slide here, may be worth looking at carefully, because someone could ask you which is the most numerous cell that forms the islets, or they could point to something like this immunohistochemical stain, saying, okay, this is a immunohistochemical stain. What cells are we staining? And because it's the vast number of cells, it's got to be beta cells. So there's all different kind of ways that we can torture you with this. But I think, especially for, like, let's say, internal medicine, this is sort of a given fact. So you got to learn it. There it is, insulin. Got to know. Okay, so I think I hope you had some fun with this session. I tried to bring in some, if anything, more bizarre clinical applications to this. And any other last minute questions?
Yeah, Dr. Honda?
Yeah.
Number 11, just to clarify, you said the answer is pancreatic duct cells, but also partially exocrine cells?
No. What I'm trying to say is that the exocrine pancreatic cells arise from duct epithelium. Okay.
I see. Okay.
And islet of Langerhans cells also arise from duct epithelium, not the exact same cells, but from embryonic duct epithelium.
Perfect. Thank you.
Okay. For some reason, I just didn't state it correctly. That the question is kind of confusing too.
It makes sense now. Thank you for clarifying, though.
Okay. So I am finished what I want to talk about. I would say if you have questions, please email me. But my brain shuts off in the early evening, and so I won't answer them until the next morning when I'm more awake. I think you need to applaud your classmates that are reading the notes very carefully and sending me these emails saying, I think I found an error. So you could, I think if you go to the announcement sections of Brightspace, you'll find a growing number of announcements about, oops, here's another error. But hopefully they're relatively few, will remain relatively few as we go along here. And I'll let you go, but there's a lot more material coming down the pipeline. TBL 5 and 6, Dr. Boyanowski and Dr. K going to cover a ton of stuff, fairly complicated. Read those very carefully. My ILS 4 is fairly complicated. I'm going to try and simplify it as much as humanly possible. ILS 4 has information that will reappear in MSK 2. And so, like I said, it's always better just to kind of get a good foundation. So when it comes up again, you go, oh yeah, I just need a little refresher. And the cobwebs are cleared out of my mind, I can go on. So I'll let you go. There's a lot to study, and start preparing for that midterm coming up Friday. And I'll see you for ILS 4 then.
Thanks, Dr. Honda.
Okay.
Thanks, Dr. Honda.
Thank you so much, Dr. Honda.
Good luck.
Thank you.